Module 4, Loss, Grief, and Bereavement. Objectives. Define loss, grief, and bereavement. Facilitate creative adaptation to losses. Screen for and assess grief reactions. Manage reactions to loss. Anxiety, depression. Follow through with bereaved family. Loss, grief. Patients and family face illness-related losses. Sense of future. Functional capacities. Relationships. Loss, grief. Reactions to loss are strong. Coping strategies vary. Helpful. Destructive. Patient losses and adaptation. Losses in all dimensions. Repeated and severe. Adaptation with declining resources. Difficult but possible. Patient losses and adaptation. Understanding, accepting loss. Disengagement and reflection. Creative adaptation, experimentation, reintegration. Patient losses and adaptation. Sense of future. Function. Self-image. Social role. Relationships. Material matters. Roles. Sick role. Caregiver role. Dying role. Bereaved and successor roles. Family losses and adaptation. Replace patient S lost capacities. Roles and relationships change. Entails losses and adaptations. Patient depends on family adaptation. Grief process. A response to loss. Part of the healing process. Multidimensional. A process. Tasks of grieving. Normal grief. Physical. Wholeness in stomach. Tightness in chest. Heart palpitations. Emotional. Numbness. Relief. Sadness. Fear. Anger. Guilt. Cognitive. Disbelief. Confusion. Inability to concentrate. Tasks of grief. Acceptance of the reality. Experience the pain of loss. Adjust. Transfer emotional investments. Benchmarks of resolution. Talk about loss without fresh feelings. Invest in new relationships, roles. Without disabling guilt. Without feeling disloyal. Types of grief. Masked. Suppression. Delayed. Displacement. Many forms. Less emotion may be normal. Resilience may be higher than expected. Assessment of grief. Repeated assessments. Anticipated. Actual losses. Emotional responses. Coping strategies. Role of religion. Interdisciplinary team assessment. Monitoring. Evolution of grief process. Denial. Anger. Bargaining. Depression. Acceptance. Grief versus depression. Grief. Loss recognizable. Current. Labile mood. Behavior. Variable waking. No history of depression. Preoccupied with loss. Confusion. Responsive to others. Depression. Loss not recognizable. Consistently low mood. Early waking. History of depression. Preoccupied with self-punitive, self-directed anger, little response to others. Grief management. If reactions, coping strategies appropriate. Monitor. Support. Counseling. Rituals. If inappropriate, potentially harmful. Rapid, skilled assessment, intervention. Support during grief. Time and presence. Education about grief, adaptation. Affirm normal range of responses. Acknowledge, encourage. Counseling. Interventions for depression. Antidepressants. Anxiolytics. Psychotherapy. Supportive. Cognitive behavioral. Combination medication and psychotherapeutic. Consultation if suicidal. Summary. Illness-related losses. Grief and creative adaptation. Grief of bereavement. Depression. Supportive interventions. Consultation for suicidal ideation.